Hello and welcome to the 3M vodcast on the CleanTrace protein test. We're here at the 3M Centre of Clinical Excellence in Loughborough, and I'm joined by Dr. Brian Kirk from 3M, who's going to explain how it all works. First of all, Brian, we're talking about reusable medical devices. How do they get contaminated with protein in the first place?
Well, when these devices are used in practice, they will come into contact with body tissues, body fluids and blood. And they are contained within these tissues and fluids are proteins which will stick to the surface of these stainless steel surgical instruments.
Obviously these instruments go through a rigorous cleaning process. Does this not get rid of all the debris?
Normally these processes would be very effective, but some of these proteins are very sticky and will adhere to the surface of the stainless steel, irrespective of the kind of disinfection process that you're using. So they will remain at low levels even after cleaning.
And does that matter? Is it absolutely crucial to get rid of all these small traces of protein?
Yes, it's very important to remove them. In the old days, people were not too worried about small amounts of residual protein because they were not thought to cause any harm. But modern research suggests that small amounts of protein on the surface can cause a disease in the next patient.
So what can be done about it?
Well, there are internationally agreed standards which describe specific tests for residual protein, and the standard method is called the Ninhydrin method, which involves taking a swab, swabbing the surface of the instrument, adding a few drops of special reagent, drying that swab and then incubating it at 110 degrees for 30 minutes. And if there is any residual protein, a blue colour will be seen.
Yeah, I was going to say that sounds incredibly complicated.
It is. It is very complicated, and some of the reagents are quite toxic.
Are there any simpler methods of doing this?
There are indeed, and one of the most recent innovations is the 3M protein test, which we're talking about today. And this is a relatively simple plug-and-play type product, which involves taking a swab of the surface, mixing the swab with a reagent, and then incubating that at 55 degrees for 15 minutes.
So this is the device here?
This is the device
here.
So
it's fairly compact and I suppose easy to use.
Very easy to use. You can see the device here. There is a swab built into the unit. You would moisten that with a few drops of special water. You can then swab the surface, place that back into the swab stick, push that down so that it pushes into the liquid, give it a shake, and you can notice that it's gone green. That would then be incubated for 15 minutes. This is one I did earlier. You can see that's gone purple. So that is showing the presence of residual protein. So the simple message is, if it's green, it's clean.
Thank you very much, Brian. And thank you for joining us for this 3M vodcast.